I think we really don't know the answer to that question. And the reason is we've only begun to look at the issue of clinician burnout systematically in healthcare over the last 2 decades. Maslock initially reported in the psychological literature and social work literature the concept of burnout in a broader work setting in the 1980s. But we've only been looking for clinicians specifically over the last decade or two. We do know that there is a high prevalence of burnout, and there may be 2 or 3 factors contributing to that. The increasing administrative burden of electronic healthcare records is something that clinicians often complain about, and we think it may be driving additional burnout. There's another important factor, and that is that there are a number of other healthcare professionals that have joined this sort of clinical fray over the last 2 decades, and those would be specifically physician assistants and nurse practitioners. Those clinicians are asked to do the work, probably 80% of the workload in terms of complexity of traditional MDs or DOs, but they unfortunately only have about 10% of the clinical hours of training that's required. So this creates a mismatch. And so burnout may be rising in the total clinician community because of those increasing phenomena.